Happy Physical Friday! Let's take a look at another video that was circulating on social media.
Black folks, you need to avoid these 3 blood pressure meds.
This information comes from a clinical blood pressure study that had 33,000 participants. It was called the All Hat study. In other words, what I'm about to tell you are straight facts. Ready? Number 1 is losartan. Number 2, lisinopril. Number 3, metoprolol. So my mama was trapped taking these meds and of course wanted to go the natural holistic route to supporting her blood pressure. This is what I got for her. It's called CMOS Advanced.
So in this video, she references the All Hat study. The All Hat study is not anything new. The All Hat study, I think it was published back in 2002. The All Hat study and studies like the All Hat study are studies that motivated the medical community to change its guidelines. Back when the All Hat study was created, we were using the guidelines of the JNC-7. Since then, the guidelines have changed to the JNC-8. Let's take a look at the guidelines from the JNC-8 that give us the reference on how we should treat high blood pressure. As you can see in the guidelines, there are treatment plans based on race, age, and kidney status. So there are a set of guidelines for Black people, and there's a set of guidelines for non-Black people. There are a set of guidelines for people who have kidney, and there's a set of guidelines for people if they're over or under the age of 60. So as you can see, the medications that she referenced in the video, she spoke on lisinopril, losartan, and metoprolol, which are some of the most popular medications to treat high blood pressure. If a Black person does not have kidney failure, it is not recommended for them to take those medications. The recommendation is for them to take a thiazide, which would be like your hydrochlorothiazide, or a calcium channel blocker, which will be the medications like amlodipine and nifedipine. So let's take a look at the chart with the different types of blood pressure medication. So these are the different types of antihypertensive medications. We have the ACE, we have the ARBs, we have the calcium channel blockers, and we have the beta blockers. So the ACE stands for angiotensin converting enzyme. They took the first letters from each one, and that's how they came up with ACE inhibitors. You can identify these medications, all of the hypertension medications, you can identify them based on the last part of the generic name. So if it has pril at the end of it, then you know that it's an ACE inhibitor blood pressure medication. So that's your lisinoprils, benazeprils, and ramipril are some of the most popular ones that are prescribed. Then there are the ARB medications. Took the first letters, and that's how they got ARB. It stands for angiotensin receptor blockers. The ARB medications, some of the most popular ones for those are losartan, olmesartan, irbesartan. And you can identify those by the last part of the name. Those are the sartans. So our medications are the sartans. Then we have the calcium channel blockers, which is the recommendation for Black people who do not have any problem with their kidneys. And those medications end in pene. So those are the nifedipines. And then we have the beta blockers. In the video, she mentioned metoprolol. Those medications end in lol. So metoprolol and atenolol are two of the most popular ones for that one. Let me speak on the beta blockers first, because I unfortunately see a lot of people who are still prescribed beta blockers. And that's been for almost my entire 20 years I've been in healthcare. We've known that beta blockers should not be prescribed as a first-line agent. Beta blockers should only be prescribed if someone has very difficult to control blood pressure, meaning they need several different medications. This should be one of the last ones. Or if the person has had a heart attack in the past or has congestive heart failure. Beta blockers affect the entire body. Beta cells are throughout our entire body. And what it does, it suppresses, it blocks the beta cells.
Beta blockers block adrenaline. Adrenaline is responsible for our energy. So what happens when our energy is blocked? It can lead to all of these complications.
So a lot of people have complications with this medication because it causes drowsiness. It can cause depression. And so just to tell you a story, one of my patients, he actually was fired from his job because he kept falling asleep at work and they couldn't figure out why. The patient was new to me, and then when I saw that he was on the metoprolol, I asked him if he had a heart attack in the past or if he had difficult to control blood pressure, how long was he on the medication. And so he had been on the medication about 10 years. What happens is, because it was the most popular medication to prevent heart attack more than 20 years ago, providers who aren't up to date on the guidelines continue to prescribe it. So what we did was change his medication, and he no longer had that issue with drowsiness. And so thankfully, because he had been at the job for so long, I think more than 20 years, they rehired him. But that's just an example of the havoc that beta blockers can cause when they're prescribed unnecessarily. I've had friends whose doctors prescribed them beta blockers, and I gave them the literature on what are the guidelines and told them to bring it to their doctor, and then they had the medications changed. So let's take a look at the actual guidelines for beta blockers and all the medication. So as you can see, it says for beta blockers, not first-line agent, reserved for post-MI or CHF, that it can cause fatigue and decreased heart rate, and it adversely affects glucose as well. Had a doctor who prescribed beta blockers for me, I would take a screenshot of this and bring it to my doctor and ask them to switch me to a different medication. Anytime a medication is changed for the patients that I do this with, pay close attention to their blood pressure to make sure their blood pressure doesn't drop too low or that it's still controlled. So let's look the top 2 medications. In the video, the young lady said that people shouldn't, in addition to metoprolol, she said people shouldn't take lisinopril or losartan.